Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at TGonzalez@EIMA-INC.com. Enjoy the show. Let's go. Okay, good afternoon. Welcome to the Let's Talk Small Data with T podcast, where we explore the power of small data in healthcare. Today, I'm so very honored to have the Advisory Board of EIMA join me to share some of their small data stories. And these examples that they will share with us today and the discussion, I am sure, for my listeners, truly help them understand what it means when we say small data and why we say it's so powerful. So let me introduce them one by one. First, we have Ron TOMO joining us from Long Island, New York. He serves as the chair of EIMA's Advisory Board. He's a retired vice president and CIO. He's a communications officer, Flotilla 13 and 13 for the United States Coast Guard Auxiliary. He's also comm specialist and training officer for the U.S. Army. He's an author and a lecturer. And he's a 210 ARRL Humanitarian of the Year for his work in Haiti. And most recently, he's a recipient of the Presidential Volunteer Service Award for 2020 from the U.S. Army, MARS, or Military Auxiliary Radio System. So, Ron, welcome, and thank you so much for joining us today. I hope I got all of that right. Let me catch my breath. Okay. Next up, we have Josh Aaron joining us from Texas, and he's the founder and CEO of Aiden Technologies, Inc. He's also the founder and president of Business Technology Partners, BT, and he is the person I go to when I have entrepreneurial questions, and welcome, Josh, to the show. Thank you so much for joining us. And last but certainly not least, we have Dr. Teresa Mack. She's joining us from Manhattan, New York. And she is attending with the internal medicine and HIV medicine department within Mount Sinai Doctors Facility Practice. She's also known as Dr. Angel to AIDS patients as per New York Daily News, which I love. So Teresa, thank you so much for joining us today. I'm so happy and honored to have you all on the podcast, and let's jump right into it. Okay, so, we were talking for a little bit about this thing called small data. We've got a whole podcast on it. We're all lovers of small data. We've seen stories happen time and time again. I just want to have a discussion with you all and understand where you've seen small data, the power of small data in your travels. So I'm going to go ahead and open it up first to Ron. And after Ron tells his story, feel free to jump in and let's have a conversation about this. So Ron, I open it up to you. You're on mute. Ron, you're on mute.
The most common thing said this year so far in 2021.
Right.
Okay, we'll start this again. Hello, everyone. It's nice to see everyone. Basically, I've been involved with systems dealing with healthcare for several years, like 40 of them. And I can see that big data actually leads into little data. And that's basically where we're at. One of the best examples, and I have many examples of this, dealing with not just medical, but also in the hospital and medical fields, but not just for patient data, for accounting data, for all sorts of things. But one of the most interesting cases, which I think brings this truly to light, and this happened a long time ago. We had a situation where we were called once by a pharmaceutical company. And the pharmaceutical company basically presented a very serious situation to us. And this was in a 1,000-bed hospital, by the way. And they presented something that basically indicated that they had given us a drug 6 months before. And this drug they found out was affecting infants under 6 months of age and senior citizens that were above 65. We had millions of patients sitting in our patient database, and now we had to basically find the big scale of what the big data part, who are these people, and then try to figure out now what is it that we have to do with them. And that's where we got to the small data side. So the big data part basically said, okay, let's go through, we'll run through all of these various databases, and we had huge databases to look at, and we pulled the population. So we pulled out, you know, the below 6 months, over 65. We got that together. But then we now had to report back to the pharmaceutical company a bunch of more detailed information, because there were very specific requests that they were talking about. They wanted to know the types of medication, in the way the form, the delivery system it was getting. And in this case, it happened to do with injectables for an antibiotic drug. So it was pretty serious stuff.
I was saying, so very specific, very.
Oh, it was extremely specific. And then once you got the population, now it's a question of drilling down in that population. Now look at, okay, what do we know about these people? We have to get this information in a small package to the pharmaceutical companies, because they need to actually contact people and run through a series of tests, because they had to see if the drug was affecting them, because it wasn't an immediate type effect. It was a long-term effect.
Okay.
And so when you look at this kind of data in a small fashion, that's how you get to, you know, really figure out and get to the heart of the power of the information. It's like, I don't actually often refer to all this as data. To me, data is the bottom line of what you're looking at in the very minimal sense. We look at this as information and knowledge and power, and that's how we look at it. And the power to be able to find these people and be able to get it to the right pharmaceutical company to look up something, that's power. And that's what small data can do. And they work together, by the way. They always work together in my experience. It's like big data drives small data, drives into that, and small data has to drill down. So.
Right. So it's like, you know, the big data can give you the high level insights, but it's the small data that you drill in and you can really identify and get down to the patient level. And it allows you some information. It takes those pieces of information or data and creates information that allows you to take action. And that's what's so powerful. And that's what makes me so excited about it. All right, thank you. Did the other, Josh and Dr. Mack, did you have any questions or any thoughts as to Ron's story right there that he told before we move on?
No, but I can see how that would be very powerful to be able to look through, characterize those patients, where they are, what they're doing. You couldn't do it by hand. And so, and it was a necessity, I think, for them to find out what was going on, and they could do it over a long period of time. They could identify them, see what's happening, and then follow them out to see if they had any of those side effects or adverse effects. So I thought that was an excellent example of how you could utilize small data.
Thank you very much. I agree.
I think it's a great example. I think it's extremely timely when you think about what must be happening right now with all of our vaccines getting out and the data that understand about how efficacy rates, side effects, challenges in the distribution pipeline, so many things that people are probably tracking and collecting in that world. I'm not living in that world day to day anymore. All of this is definitely fascinating to me and always has been.
Yeah, and then speaking of which, I was just talking with a group in Alaska who I will be interviewing very soon about what they've implemented in their shop to manage their population. And they have some tremendous success with COVID vaccination percentages. And they're actually following and studying those different groups. that got the vaccinations and like tying in information as to their other comorbidities and other things happening, but all possible because of the use of data and really drilling in using the small data and improving quality. So it's really exciting. So Josh, before we move on to Dr. Mack, did you have a specific story in your journey you'd like to share, or an example that kind of highlights the importance of small data and even better, the power of small data?
Yeah, I mean, I think the thing that came to mind for me when I was thinking about coming on your show, Denisa, was I really think that there was a tremendous challenge with the volunteer social services agencies in New York State when I was doing a lot of history. And by comparison to New York State at large, they had a relatively small amount of data inside of each organization. But the state, has a much bigger view of things, right? So they have a state system of record. They want every single volunteer social services agency to be able to report all of their findings across their populations into that system of record. But the individual volunteer agencies in New York State have the challenge of figuring out how to interface with them. I believe you and I originally met when you were working with HealthFix and doing some of that work on the back end.
Yes.
Regional health information offices. I worked at a large fairly large, maybe the third largest in child services and evidence-based care for this type of work, a volunteer social services agency. And one of the biggest problems that I feel we had was trying to figure out a way to create a data integration between not only we had two different populations, we had two different electronic health record solutions, but on top of it, we had to integrate with HealthFix, with the New York State Regional Health Information Offices, and the state system of records that are provided out of Albany. We had to find solutions for that. And we actually turned to third-party technologies like Informatica to be able to build, data integration layers, data lakes, reduce duplicate data entry in our own agency. The things you find is if you have a couple of different systems of record across a diverse population, you have workers that are social workers, care providers, and administrative support staff, and they're all entering the same data for many things in those populations across multiple systems.
Right.
There are challenges with facilitating a way to aggregate the reporting across the entire population, even for senior managers in the agency or the organization to look at the data. And there's challenges with giving that data to downstream care providers, kind of like how do you break it off in chunks to give it to like the transportation company that move people around? They may only need a subset of the data.
Right.
So tools like Informatica were really important in being able to create little data sets that we could give out to various people, with aggregation layers across all the systems of record, and be able to share that with the state. But we were even able to do some really fancy things like screen scraping and robotic process automation to be able to, if they entered a bunch of case notes in one system, but for our records, we needed those tracked in multiple systems, take that note one time, only make the social worker or the care provider enter it once, and then screen scrape it and add it in the back end to all the other systems. So it didn't have to be duplicatively added to all those systems.
Right. And that sounds like some big data stuff happening behind the scenes. Yeah.
Yeah, I mean, relatively small data. We were dealing with a population of about 30,000 compared to all of New York State, right? But in our world, it was extremely important, and with limited resources and limited funds, finding innovative ways to do these things in the back end to make it easier to interface with all the third parties we had to interface with every day.
Yeah, I mean, I like the point you bring up with the multiple systems, all the disparate systems, and then folks entering the same type of information, maybe the same data in multiple different places. Like, what do you do to bring it all together, validate it, first of all, and then make sure that it's making sense and that it's valuable on the other side, for whomever has to use it. A social worker may have one need, doctor may have another need. And I remember even when I was at the HIE, there were tremendous challenges around just that, bringing in all the data and trying to create great idea, right? Bringing all this data from all these different places into one view but very challenging because, you know, the patient can have a number of different unique IDs, and then we have to make sure that one patient has one ID. So that alone created an issue. But yeah, so that's a great example, Josh. I love it. I mean, and a lot of my real passion comes into when we use these tools to drill into the small data to really drill down to the individuals, the patients, to come up with solutions for improving the quality of care, right? So that's a lot of the work that I do, really driving home, creating tools and views that will help providers and make it easier for them to manage a cohort or patients to drive improvement in care. So thank you for that. Dr. Mack.
Hi, good
Hi.
afternoon. How you doing?
Doing well. How are you?
Okay, I'm so amazed with the small data discussion because it makes me see outside of medicine how it's being used. And I'm just only familiar with it, but just the example of so many people not being duplicative and being more efficient, that can be across any business. But really, for me, in medicine and primary care, it really requires a team. It's not like the old time where the doctor did everything by themselves and nobody could do anything. Those days are gone. And we really need some artificial intelligence to kind of help us. In primary care, we say it's preventive care. We want to prevent the disease. We don't want to just treat it. And with this, the team that we have has to be a partnership, a dialogue, so we can learn from each other. And the team prevents fragmented care. But small data allows you to end fragmented care. And what do I mean by that? I mean that say how big or how small your practice is, you can characterize that practice by using small data, which you really couldn't do if you had to do it manually and by a ledger and, you know, as the people come in. I like small data because it can identify the patients that come in, what are the top comorbidities that we have in the practice, and do I have the social skills and the social services to help? That's very important to me. And where are my patients living? What's their zip code? Are they homeless? Are they incarcerated? Can they get to my office? And it identifies, and now it's so important to identify patients by race, gender, and gender identity. You can't do that if if my patient panel is only 2,000 patients, I could never get that done by just doing it manually. But again, small data can provide vital statistics on if I'm open 12 hours a day, what's my most productive time? When do I need to have more doctors there? When are the most new patients coming? What is my total number of patients? How many visits are I getting a day? I just love small data after dealing with Tanisha, okay, because it really helps your practice. And then even on the physician side, we can, and physicians are a group of competitive individuals. Don't let them tell you that they're not. So if they want to know, I saw 10 diabetics and you only saw 5, they're going to want to try to do that. And so it's a healthy competition. But small data really drives quality and performance improvement. And it can identify what quality improvement projects you need. It may not be the same for another doctor's office. And it can measure the improvement over time. Just like in the first example, he needed to find out if there was a problem and he could do it over time. And that's what I like about small data.
I'll tell you actually one thing that I thought was very interesting. I had time working with LIPIX and HealthX. But basically, you know, dealing with of everything. And one of the things that was very critical in response to actually both what Josh and Teresa are both saying, we had situations where we had to decide there was so much data because once we joined, you know, like 7 hospitals and multiple doctors' office and all of this, sitting there with literally millions and millions of pieces of data. Well, one of the things we really needed to know right away was things like, is this guy allergic to anything? Is this guy, because when we're in an ER and you show up, I'm not interested necessarily in that you had a cold, last Tuesday. I'm interested in the fact that you're allergic to penicillin. The fact that you had certain diseases, certain things that pop up. So small data, so I was deciding what we wanted to show our doctors up front immediately. You can't go through this. When you go through that class and you're into, the everything world, you have a tremendous amount of stuff. And frankly, there's not enough time to look at it all. You can't, it's impossible. Yeah. So you try to focus on the small piece, and that's the piece that is most critical to you. So all of these examples are great, and the small data is what makes it happen. So, it's perfect.
Yeah, no, totally. And that small data really helps you prioritize your efforts. That's what I felt like. And, I think, Teresa, you were talking pretty much about the social determinants of health, right? Data can really help you scour your EMR and really understand the social determinants of health. And you may have this cohort of patients who are homeless, and they also have this issue. Oh, and they're also opioid drug and
so true.
Just addressing these different issues. But I'll tell a quick story, and I tell folks, like, my proudest accomplishment is when I was at the HIV/AIDS clinic at a health system that will remain nameless right now. And it's one that I worked with Dr. Mack at for 10 years. So I built a system there called the Data Mall. And basically this was a population management benchmarking tool that I built from scratch, basically. And I know Josh and Ron are IT folks, and you can close your ears for a second, but this was, my system was built on Access, Microsoft Access, because that's what we had. And those are the skills that I have. And I was able to, boom, create a system that allowed us to see for our 3 clinics how we were doing on our key quality metrics and how we were doing as compared to our peers in the state, and also how each of my PCPs were doing amongst themselves, their peers within the clinic. And you could see how you were doing on specific metrics. And there was one metric that we drilled into, and we saw the poor performers and we saw the other form, the high performers, and we put them in the same room. And we said, what are you guys doing that these guys could learn from? And it was really eye-opening. And it just came down to 1 or 2 common sense key things. Remember, Teresa? And it was just, like, this tool drove like the quality improvement program. It was like the center, and it was the program that helped identify, okay, what's the next intervention? Okay, what's the next project that we're going to focus on? It was just really exciting. And that's when I got really excited about small data and decided, you know what, this is me, this is my thing. And I don't care if I'm using a big data tool or, or whatever. It's about, like you said, Teresa, the people. And just exactly, what are you trying to do? What's the destination? Yeah, I've been talking.
I agree. You know what? I just want to interrupt you, because when you're dealing with, and I know you're going the gamut, but if you're looking at a primary care or a medical practice, when you put these doctors together, it's not punitive. It's for quality improvement. And we have to change that. So if someone's on the lowest performance side, we just want to make you better. Okay. And so we're not punishing you or anything. And that's what I think people have to understand. This is a way to make quality better. And if you make quality better, you're going to have healthier patients. If you have healthier patients, that's why you went into medicine in the first place.
Exactly. And there's nothing wrong with a little healthy competition. It's going to be there. When we started showing scores up on the billboard in the clinic with initials, providers, whoa, wait a minute. And then the numbers started going up. So, it really makes people pay attention, and ultimately it improves the lives of the patient.
And it has to be transparent though, T.
Yeah.
You can have initials, but it has to be transparent. And why wouldn't it not be? And so it is a whole shift of how we have to do the culture of medicine.
Right.
I think that's a big point, actually.
Talk about access, and I think it's great to use the tools that you have. At your disposal. It's so important. Being able to provide the the people who run the practice and the clinical providers with the information they need to understand to do their jobs better.
Right.
I mean, whether it's a big SQL database or Oracle, or you're doing it with Access, you're giving them visibility into the data they need that make things, happen for them. I remember doing this at small clinics with the EHR Meaningful Use Program, making sure they understood how to get the funding they needed to put in the health record system, and then minding those systems for the quality improvement metrics. And a lot of that early work at small providers was all done in systems like Microsoft Access, or even Excel.
Yes.
To get
I was going to say that we did a tremendous amount of work passing, small data into Excel spreadsheets and just
You could do a lot. You could do a lot with Excel. My gosh.
It also, the small data, what was nice about it for us too, is that a lot of, medical people and general hospital people, they wanted to also look at stuff in their own way, and gave them the ability to say, look, here's the small data of what you're looking at. You now can do however you want to work. You can now, strip out what you need and look at it very carefully, and it's in your control. It was very helpful to these people. But yeah, we use all that stuff. We've used Access many times because a lot of people don't need a lot of data. They need a tiny piece of something. You don't need a huge system for that.
Right.
So it works very well.
I've had folks in New York State, AIDS Institute, come to me and say, listen, we're working with these folks, in this country, that country, and they've actually come to me and say, can you help us out? Because all they have over there is Access. And I was like, sure thing, boom, make it happen. But, I love, I've been talking to folks in many different industries in many different countries. They all have an appreciation for small data. They all have the same struggles that we have in healthcare. Of course, my first love is healthcare. So that's my podcast is really focused on the power of small data in healthcare. But the power of small data is across many industries, as you guys have made clear. But I'm so happy to have this brief discussion with you all. I just wanted to have a small discussion with you on the power of small data to try and come up with some examples so the listeners can really understand, first of all, who you are. And thank you so much for supporting Emma all these years. I really appreciate your support and working with me. And the podcast is a huge success. And I could talk about small data all day long with all of you and everybody I'm on the podcast, but I want to be mindful of time, respectful of your time. And I so appreciate you meeting with me today to chat. Anything else you'd like to bring up before we close?
I think actually future sessions, because there's literally, I can think of hundreds of these things. Right? It's like after spending 40 years doing this, I have tons of stories like this. And I think it's good for people that really want to understand small data to hear all the different variables, because there are so many amounts. So, and I think it's a good idea to continue. And I think it's a good idea for people to hear all this.
Definitely.
I agree with that.
Okay. Now I will definitely drag you guys into another session, because a lot of people are saying, wow, this small data thing, I like it. I'm interested. I want to talk about it more. A lot of people have said to me, you know what, we've never really thought about it this way. And I'm like, what? Because I've been living this like for so long. But yeah, no, totally. I will definitely set up another session and different topics and whatnot. And we've got a couple of shows lined up, really interesting shows coming up, talking about small data and different pockets of healthcare. So thank you so much for joining me, guys. I want to thank my guest today, which is the Advisory Board of EIMA. They have been working closely with me for so long, very supportive, and I'm so very grateful. Ron TOMO, Josh Aaron, and Dr. Teresa Mack. Thank you, and thank you to the listeners for tuning in. To subscribe to the podcast, you can find us on Spotify, iHeartRadio. Tune in and look up Let's Talk Small Data with T, no apostrophe. You can also visit EIMA-Inc.com and click on Let's Talk Small Data to learn more about the podcast. And this brings us to the end of the program. And I want to say have a wonderful day. And remember, unleash the power of your small data. It's your most valuable strategic asset. This episode is brought to you by Effective Information Management Assistance, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about Emma and the podcast, Let's Talk Small Data with T.